Hello, everyone. Happy afternoon. A very good afternoon. I hope and I believe all of you are doing well. A quick note whether the audio visual is all good. Yes. All right. So here we are. I can see the audio visual is good. And let's start with the discussion of the today's topic. This is NF100. What is NF100? Basically, it is NEET PG FMG top 100 topics, and we are at episode 65. The last episode we had was we had acid-based disorders, right? So here today we are going to discuss cardiac murmurs because it has become a very important topic for your exam. We get image-based questions, right? A lot of questions are expected on cardiac murmurs. And after this, we will be having the special class also at 3:30 p.m. Like in the next half an hour, immediately we are done with this YouTube live class. After that, we would be having the special class on the app as well. And special class, it's basically a free class. If you are asked for the code to join, you can use the code Dr. Nikita. The link I've shared on the Telegram group. We will be having KBMD episode there. KBMD is Kaun Banega MD. That's a live quiz with leaderboard. So if you have not experienced it before, you should be definitely attending that class. On my end, or there's a problem with the video? Is everyone able to hear me and see me? All right. Let's start with the discussion. So here is a pre-session assessment question for each one of you. Please let me know what do you think is the answer to this one. Yes, the answer here is aortic stenosis. Okay, the answer here is aortic stenosis. I have tried to reset the network. I hope this works well now. Let's see. All right. So the answer here is aortic stenosis for everyone who got this right. That's correct. I'll tell you why the answer is aortic stenosis after we are done with the discussion of this topic. Okay. And even before I start with the discussion of the topic, and I forget to tell you about this. So remember, we have a price hike of up to 20% tonight at 11:59 p.m. And for whoever is planning to take up the subscription, please make sure you do it today so that you save the 20% extra, right? And you can utilize it somewhere else. And you can also use the code Dr. Nikita to get additional 10% off when you are subscribing. Now, after subscription, the batches that you can follow are the NEET PG 2023 batch, where we are planning to do the subject-wise individual batch. It will be done in 6 months. And the next, then in the 3 months, we'll be also doing the high yield revision. And I'll be basically catering to radiology in this batch. And also for the repeaters, those who are attending again, we have started with the test and discussion batch. Okay, we are starting with the test and discussion batch today. Again, we have the test and discussion. We have radiology starting on 13th of June. Okay, right? 13th of June to 18th of June. We'll be completing radiology. It will be a live TND. Every question followed by the discussion. Why the option A is answer, the rest are not the answers. All of that, all the important questions in radiology will be discussed. And that is starting on 13th of June, right? A reminder for everyone, 13th of June, we'll be starting with the plus course. All right. Apart from that, in the NEET PG subscription, we have the Plus Iconic, which is with Prep Ladder, Light subscription, which is only for test series, Prof 1 and UPSC CMS subscription also, which is available. All right. So, yes, here it goes. And let's start with the discussion of this topic. The first one here is, now in this session, we'll be discussing the important points and murmurs. Then in the special class, following this session that we have, that is at 3:30 p.m. we'll be doing the MCQs in the form of KBMD, right? We'll be doing the MCQs also. Okay. So let's start with the discussion of this topic. Most important is understanding the auscultation areas. Okay, what are the important auscultation areas? Where is the aortic area, pulmonary area, tricuspid, and the mitral area? So for that, the mnemonic is basically, remember, the mnemonic is all people. Okay, the mnemonic is all people enjoy the money. Okay, that is what the mnemonic is. It is all people enjoy the money. That is, you start from the right second intercostal space. All is aortic area. Then you have the pulmonary. Then you have the herbs area, tricuspid area, and mitral area. So basically, this is the sequence that we have. You start with A, all people enjoy the money. Right second intercostal space, aortic. Then we have the pulmonary, left second, herbs, tricuspid. You can see these are along the left parasternal border. When they mention left lower parasternal border, basically they are talking about the tricuspid area. And mitral area is in the apex, right? In the apex, the mid-clavicular line, that is where we have the mitral area. So first point, very, very important to remember where the auscultation areas are located. After that, the next important trick, like I believe that the topic of murmurs is more concept based. If you understand the concept, then you can solve the questions very well. If you are looking for a mnemonic, which is SSSS. That means if you get confused with the systolic murmur, which is diastolic murmur, so the trick here to remember is SSSS. That basically is stenotic lesions of the semilunar valves. Now, which are the semilunar valves? The aortic valve and the pulmonary valve, right? The aortic and the pulmonary valve. It's lacking a lot. Is it still? It's still there's an issue with it. All right. So aortic valve, pulmonary valve, these are the semilunar valves. So the stenotic lesions, that is aortic stenosis, pulmonary stenosis, these would be systolic murmurs. Okay, these would be systolic murmurs. Septal defects are also your systolic murmurs. S is your septal defect. So what is the trick that we learned here? So remember SSSS, that is stenotic lesions of semilunar valves and septal defects. These are the systolic murmurs. Okay, these are the systolic murmurs. So if you remember this one thing, then you can derive for the rest of the valvular lesions what kind of murmurs they would be. So if the stenotic lesions of the semilunar valve is systolic, right? So the regurgitant lesion of the semilunar valve, stenotic के बदले regurgitant, systolic के बदले these will become diastolic, right? These will become diastolic. If the stenotic lesions of semilunar valves are systolic, the stenotic lesions of the AV valves would be diastolic. Okay, they would be diastolic. If the stenotic lesions of AV valves are diastolic, the regurgitant lesions of the AV valves, they would be systolic murmurs. Okay, they would be systolic murmurs. So basically what you have to do in this table is, once you know that this is S, S and S, right? That is stenotic, semilunar is systolic. When you change one of those, right? If you keep one of those constant, ki semilunar ka stenotic systolic hai, so semilunar ka regurgitant would be diastolic. Do the opposite of the rest of the two, right? Now, similarly for this first line, the opposite that we are doing here is we are keeping the stenotic same. So stenotic of AV valves would be diastolic, right? If stenotic of semilunar is systolic, stenotic of AV would be diastolic. If stenotic of AV is diastolic, regurgitant of AV would be systolic. Now, this is based on mnemonic, but I would personally suggest that You can remember this with the concept. What is the concept? Stenotic lesion of a valve. Remember that a valve is like a door. If you make it stenosed, that means you make it narrow. So what will happen in that case when the blood is flowing through that pipe? Okay, any pipe if you make narrow. So when the water is flowing through it, there will be sound. So basically the stenotic lesions will give the sound when the blood is flowing in the forward direction through that door, right, through that valve. So now tell me, through the mitral valve, when does the blood flow? Mitral valve, blood flows during systole or diastole. Through the mitral valve, the blood flows during the systole or the diastole. Yes. So you have the left atrium, you have the left ventricle, and you have the mitral valve. The left atrium is emptying into the left ventricle through the mitral valve. This is basically during the diastole. So that is why remember that mitral stenosis would be a diastolic murmur, right? Now from the left ventricle, you have the aortic valve and then you have the aorta. When does the blood flow through the aortic valve? When the left ventricle is contracting, that's basically the systole, right? That's the systole. So aortic stenosis would be systolic murmur. Mitral stenosis would be diastolic murmur, right? More easy to remember conceptually. So basically when the blood flows through the stenotic lesion, we will get the murmur, right? We will get the murmur. Aortic valve say blood flows during systole. So aortic stenosis is systolic murmur. Mitral valve say blood flows during diastole. So mitral stenosis is a diastolic murmur. Is this clear with everyone? Why aortic stenosis is systolic and mitral stenosis is diastolic murmur. Opposite will be true for their opposite conditions. So mitral regurgitation is systolic or diastolic? It's a systolic murmur. And aortic regurgitation would be a diastolic murmur, right? They would be opposite. The backward flow. Regurgitation is basically the backward flow. So you make the opposite of the stenotic lesions. So if you just remember this, through the mitral valve, the blood flows during the diastole. Therefore, mitral stenosis is a diastolic murmur. Through the aortic valve, the blood flows during the systole. Therefore, aortic stenosis is a systolic murmur. If mitral stenosis is diastolic, mitral regurgitation would be systolic. If aortic stenosis is systolic, atrial regurgitation would be a diastolic murmur, right? It would be a diastolic murmur. Everybody is clear with this? No, Dr. Sri Rathod, when we solve the MCQs in the KBMT, I'm pretty sure you'll be fine with that. Okay, you'll be fine with this concepts. So that is what it is. Now, how to identify? This is very, very important. It has been asked in the previous exams as image-based questions. How to identify whether it's a systolic murmur or a diastolic murmur on the image-based questions? Remember that diastole, di is 2. So diastole starts with S2. Okay, the diastole is between S2 and S1. Systole is between S1 and S2. So if you see the murmur between S1 and S2, it's a systolic murmur. If you see the murmur between S2 and S1, it's a diastolic murmur. This is a very, very important trick to identify the murmurs, whether it is between S1 and S2 and S2 and S1. Okay. And you can also see that this complete one cardiac cycle, this is the systole, this is the diastole starting with S2, and diastole is longer as compared to systole, right? Another question in cardiac cycle. Out of systole and diastole, which is longer? It is the diastole which is the longer, right? It's the diastole which is the longer. Now coming to systolic murmurs, all of you remember this point? Aortic stenosis, the blood flows during systole, so it's a systolic murmur. Similarly, pulmonary stenosis, these both are similar. Septal defects, they are systolic murmurs. And even your HOCM, hypertrophic obstructive cardiomyopathy, where you have the left ventricle ka asymmetrical septal hypertrophy, that is like a obstructive lesion to the blood flow during the systole. So it is a systolic murmur. So So aortic stenosis, HOCM murmurs are very similar. Okay, remember they are very similar, but we can differentiate them based on other properties. We'll see that. Okay. Now look at the murmur of aortic stenosis. How will you identify murmur of aortic stenosis? Aorta is systole. This is a systolic murmur. So between S1 and S2. So you will hear the murmur between S1 and S2. Now, even in S2, you have A2, P2. A2 comes first, P2 comes later, right? A2 comes first and P2 comes later. Now, what happens as the aortic stenosis becomes more and more severe? What will happen? Now, the aortic stenosis, because of the narrow outlet, the blood flow takes longer time to go through the aortic valve. That is why the aortic valve will close later. So, your A2P2 will now become P2A2. Aortic valve will close later. So, you can see this red line, that is A2 going after the P2, right? So, what is this called as? This S2 ka split. What is this split called as? This is paradoxical splitting, right? This is called as paradoxical split of S2, which is basically P2 के बाद आता है A2. Normally comes A2, then comes P2, right? Remember paradoxical split, it is aortic stenosis. Okay, it is aortic stenosis. A2 will close later on. Okay, A2 will close later on. Now, after that, pulmonary stenosis, similarly, this is what you would be seeing. But if there is pulmonary stenosis, what will happen? The pulmonary valve will close late, right? The pulmonary valve will close late. So what will happen in that case? You can see this pulmonary valve, mild में pulmonary valve यहाँ पे है, moderate में it is here, in severe it is here. So basically the gap between A2 and P2 will go on increasing. It is not paradoxical. Paradoxical is in aortic stenosis. Okay, remember this point. Paradoxical is in aortic stenosis. Right, absolutely paradoxical or reverse. Okay, that's your reverse splitting is what we are seeing. So here we are seeing the wide splitting. Okay, the wide splitting. Now going to ASD. Very, very important point about ASD, almost always asked in the exams. What is that point which is asked in the exams about ASD? ASD has wide fixed split of S2, right? Wide fixed matlab inspiration and expiration mein it does not change. Look at the expiration, the split of the S2. Look at the inspiration, the split of the S2. It is the same. It is not changing. This is a systolic murmur that we are seeing. So this is a wide fixed split S2. It's not changing with inspiration or expiration. And look at the murmur of aortic stenosis also. It is crescendo, decrescendo, right? This is called as ejection systolic murmur, basically which is the maximum in the mid-systole, right? It's a crescendo, decrescendo murmur, right? Crescendo, decrescendo murmur. Please note down all these points that we are mentioning. All of these are very, very important, right? Aortic stenosis, reverse splitting. Pulmonary stenosis, wide splitting. And ASD, it is fixed splitting. Okay, it is fixed splitting. Now, so how do you distinguish the murmur of HOCM and aortic stenosis? The ones which we said are very similar murmurs. So based on dynamic auscultation, very, very important trick, mnemonic for HOCM murmur. Remember the HOCM murmur increases with VAST. Okay, remember these points that HOCM murmurs increases with VAST. What does VAST stand for? Valsalva, amyl nitrite and standing. Okay, Valsalva, amyl nitrite. ST stands basically for standing. Right. So now look at these murmurs. The murmur of HOCM, the murmur of aortic stenosis. Both of these are systolic between S1 and S2. Both of these are crescendo, decrescendo murmurs. So we need to differentiate them. So do the Valsalva or standing. We said the VAST, Valsalva and standing. HOCM murmur will increase. So look at the height. The HOCM murmur is increasing. The aortic stenosis murmur is decreasing. Look at after squatting. What happens after squatting? What is the effect of squatting basically? In dynamic auscultation, what does squatting do? How does squatting help in dynamic auscultation of murmurs? Yes. Murmur after rapid squatting, it is increasing. Okay, it is increasing. Okay. So remember this point, that is for aortic stenosis. Now let's measure with a force, and that force is transmitted from the aorta to the carotids as well. Okay, from the aorta to the carotids as well. So remember that aortic stenosis ka murmur, it radiates to the carotid, not the HOCM ka murmur. Okay, not the HOCM ka murmur. Okay, so let us do one thing, guys. Let us do this one thing. Shall we continue this session in the special class that we have in the next 10 minutes at 3:30? So that the rest of the part of the murmurs and the MCQs on that also we can discuss in the special class. I think there's some buffering which is happening, some network issue. I hope the special class would go well. Just give me a quick thumbs up so that we can continue the rest of the parts. That's the pansystolic murmurs. Then we have the diastolic murmurs. वगैरह बाकी के जो murmurs है, we have diastolic, systolic murmurs. Everything remaining we'll discuss in the special class. Okay, the rest part of it. Right? Okay. So, okay, Catherine, Preeti, and everyone. The link I have shared on the Telegram group. You can also check the profile on the Unacademy app. Please be there on the app. It's a free live class. The code is Dr. Nikita. We'll be continuing and we'll be simplifying the rest of the topic of murmurs. Just hold on. It might seem a bit confusing now, but once you get a hang of this topic, it's very, very important topic and it will help you solve a lot of questions, right? The clinical integrated questions, it will help you solve a lot of those. Okay, so see you in the next 10 minutes on the Unacademy app for the special class. Continuing with murmurs, and the KBMD of murmurs only is what we will be having. Okay, thank you so much, everyone. Goodbye, take care. And reminder that please remember that we have the price hike of 20% today. So if you are planning to take a subscription, please make sure you do it today itself. Okay. See you on the app in the special class in the next 10 minutes. Goodbye, take care, and keep studying, keep revising, and keep